You're watching Real Hope with W.L. Laney, and my guest today is Dr. Jeffrey Lazarus, MD. Dr. Lazarus, it is so nice to have you with us today. Welcome to the program.
Well, thank you so much for this opportunity. It's an honor to be here, Mr. Laney.
First question, how long have you been a doctor?
Oh, let's see. I finished medical school in 1978, and I finished my pediatric residency at Stanford in 1981.
So you're just, by certain standards, you're just a young man.
Yeah, seasoned, huh?
And what is your specialty?
Well, I'm a general pediatrician, and after doing my residency at Stanford, I practiced general pediatrics in Cleveland, Ohio for many years. And then I became interested in medical hypnosis, and I moved back here to Menlo Park, which is near Stanford, 12 and a half years ago to practice medical hypnosis and something called TEAM, T-E-A-M, cognitive behavioral therapy. And I just love coming to work every day.
Okay, so tell me about the whole issue of utilizing hypnosis as part of your medical practice. That's a little unusual for the typical doctor today.
Exactly. So when I practiced general pediatrics, I learned that there were many conditions for which traditional medicine either didn't work or had side effects. And this is where medical hypnosis really shines. The most common patient problems I see are patients who have performance anxiety, such as test anxiety, sports performance anxiety, musicians, dancers, actors with stage fright, public speaking. I see people with headaches of all sorts, chronic daily headaches, migraine headaches, tension headaches, people with bedwetting, people with irritable bowel syndrome and other abdominal or gastrointestinal issues, people with chronic pain, and I have a special interest in patients with tics with or without Tourette syndrome.
Okay, I have read that up to 70% or more of all doctor visits are stress related. Do you find that in your practice?
Well, I have a different type of practice since I don't do general pediatrics anymore. But yes, certainly there's a lot of stress, and there's a lot more stress, and there's a lot different stress now than we used to have. I mean, you look at the COVID situation. I mean, how can it not be stressful? You know, initially for some of the children when COVID came and a lot of these kids then had to go to homeschooling, the anxiety of school went away because they were home with their parents, sheltering in place. But then, you know, COVID is still here for a while, and it brings up other issues. And then now school has started again, so the same back to school anxiety is there. And yes, you're absolutely right that anxiety leads to a lot of physical illness. There's a strong mind-body connection. So if you're not feeling well emotionally, it's going to affect you physically. And if you're not feeling well physically, it's going to affect you emotionally. And again, you're right, because there are certain conditions for which anxiety or stress are well-known triggers.
Right. Well, I would guess that the stress just changed bodies, and it went from the children being stressed to the parents being stressed when it came time to homeschool your child.
Everybody's stressed. The children are stressed. The parents are stressed. For those families who are lucky enough to have parents be able to work from home, for example, remotely on a computer, think of these families, what's going on with them. And you are so intuitive about this. Parents now are at home working, but they have to take care of two little kids. They have one home, depending on if it's a small home, then these kids are Zooming remotely for school, or they're too young and the parents have to work and take care of the kids. They don't have school as to watch the kids during the day. It's just been horrendously stressful for these families. And the parents who are first-line workers, they have their own stresses, and it's been a mess.
So let's go back to your specialty. What initially got you interested in the power of hypnotism to make a medical change in the patient?
This is a wild story. I had plantar warts on the bottom of my foot, very common problem. And I saw my friend, the dermatologist, this was when I was in Cleveland, and he did the standard treatment. He froze them, put different topical medications on them, and after meeting with him every 3 or 4 weeks for 15 months, including driving through the snow in Cleveland. There was no change, and I was very frustrated. And then I remembered many years previously, I'd had a little 5-year-old boy in my practice who had had hundreds of warts on the backs of his hands. They were terribly disfiguring. He had been to several dermatologists, even went to a surgeon who wanted to put him under general anesthesia and remove them. Fortunately, they didn't do that. And he went for self-hypnosis one time, and a month later they were gone. So the mother told me this story. It was her third child. I knew the family well. I remember talking with her as if it were yesterday in the exam room. And I asked her, I said, "Are you telling me the truth?" She said, "Yes." I said, "Okay." So I called Rainbow Babies and Children's Hospital, the local children's hospital in Cleveland, very fine institution. And I was referred to a professor of pediatrics named Karen Olness. I didn't know Dr. Olness at all. Turned out she was internationally known in this field and had co-written the book on pediatric hypnosis. And she was very generous and agreed to see me as a patient. We met one time. She taught me a technique commonly used in adults that involves deep muscle group relaxation, muscle group by muscle group. And then she said, when your body's relaxed, you can go to a place in your mind where you feel happy, safe, and comfortable. And when you're in that special state of mind, Jeff, tell yourself, I will no longer feed the warts. And do this exercise 10 minutes twice a day and call me in a month. So every time I did it, I visualized the blood vessels constricting at the sites of the warts, and I actually felt tingling only where the warts were. It was really strange. Long story short, 3 weeks later, they were gone, never came back, and I was hooked. And I called her and I said, "This is remarkable." I said, "I have to learn how to do this so that I can teach my patients." So I've been really fortunate, Mr. Laney. I've received the best training from the top pediatric hypnosis people in the world, from the top adult hypnosis people in the world. I've learned cognitive behavioral therapy from one of the pioneers in the field here at Stanford. I've really been very fortunate in the training I've been able to receive.
Okay. Can we go back for just a minute? Because I really want to understand exactly what happened. You've got the plantar warts on your feet. You're not getting relief any other way. And you hear about a hypnosis that removed plantar warts in a child. You went
Correct.
to this doctor and she told you to do what?
Visualize. Just the power of the mind. So visualize the blood vessels constricting at the sites of the warts. So all I did was I went into the state of hypnosis. Whether you call it hypnosis, visualization, guided imagery, mental imagery, daydreaming with a focus, it's all pretty much the same thing. And I visualized the blood vessels constricting at the sites of the warts just with my mind, and it worked.
Okay, so there's no at this point there was no specific training. There was no lessons that you had to take. The doctor just told you, visualize this happening.
Exactly. I was a patient. First and only visit with her.
And that's amazing.
Yeah.
It is. I'll tell you what's really amazing to me is because I'm reading a lot of books on the power of the subconscious mind, and I'm reading Dr. Lisa Rankin and her story, and Dr. Bruce Lipton and his story. And as I'm reading these things, it's just kind of amazing me. In fact, I'm laying in bed one night and I'm just thinking about all of these things that these doctors are saying have happened. Right? So I'm 76 years old, osteoarthritis in my feet, getting around with a walker and a cane, using an electric scooter.
Oh, good heavens.
And I'm laying there in my bed and I'm thinking, now wait, why do I have to have arthritis in my feet? That's all it took. Woke up the next morning, the pain was gone. 4 or 5 days later, we had a garage sale, sold the scooter, and I'm, what they say, back on my feet.
Literally and figuratively. What a story. So how do you explain that?
How do I explain that? Well, for me, there's two ways to explain it. One is the power of the subconscious that, and Dr. Lipton talks a lot about how you have to reprogram your subconscious mind because it's been fed so much negative stuff, and you reprogram that, and the positive enzymes go to work and your body heals itself. And of course, they talk about visualization as part of that process. And then on the other side of the issue, I believe in prayer. Now, I have to tell you that in this situation, I didn't do either. I neither prayed nor visualized my feet getting better. Go ahead.
Good. And I believe what happened was you consciously did something that caused a physiologic as well as emotional and psychological change.
Yes. And I believe you, and you tell me if this fits with what you are doing. I just simply began believing that what these doctors were saying is true, and that the stories that they are telling was true. I accepted it as fact, and if it's a fact for them, why not let it be a fact for me?
Absolutely. And that's exactly how this works. It's
okay,
absolutely remarkable.
So then, from your own personal experience, then how did you move from there to incorporating it into your medical practice?
Okay, so I'm a pediatrician, so there's something called NIFTI, National Pediatric Hypnosis Training Institute, NPHTI, and offers training for professionals who deal with, for medical professionals who deal with children. So I took their introductory workshop, very intensive, all day Thursday, all day Friday, all day Saturday workshop. And then I went home and I had to practice, and I was very fortunate. One of the guys who was in charge, Dan Cohn, world's expert, he's the other co-author of the book that I mentioned earlier. He was very kind and took me under his wing, and I would videotape my sessions and send them to him, and he would review them and send me his comments, and I really got into it. It became a real passion to me and a real life changer. And what an honor and a privilege to work with patients in any way, but to finally be able to offer patients things, as I said, for which traditional medicine either didn't work or had side effects.
Okay.
And then I've taken, then over the years you take more and more workshops and more and more workshops, and I've been privileged. I've written articles and chapters and have had the opportunities to lecture all over the world on my approach to these conditions. So, but to me, the biggest joy professionally is meeting patients one-on-one, either in the office or now with COVID on Zoom, and empowering them to help themselves. Okay,
so tell me again, what are some of the areas that you treat with the hypnosis?
Sure. So one of the most common ones is people with headaches, and what came to my mind when I took my very first, my daughter, who was 9 years old at the time, had childhood migraine headaches, and she would have an aura. The aura was a signal that the migraine would happen, and she'd say, "Daddy, the needles are starting in my eye," and then that was a signal. 20 or 30 minutes later, she'd get a horrific headache, start vomiting for a couple hours, then have to go lie down in a dark room for 6 or 8 hours, and it would then sleep it off, and then she'd wake up and be fine. And I felt so helpless. Here I was, a pediatrician, and I couldn't do a thing for my daughter. And then at 11 o'clock on Saturday, we had the lecture on how to treat patients with migraine. And at 12 o'clock, I called home just to say hi. And my daughter answered the phone. She said, "Daddy, the needles are starting in my eye." I said, "Hey, we just had the lecture on how to prevent migraine. You want to do it?" She said, "Sure." 5 minutes later, the migraine was gone. Never had another migraine. Unbelievable.
That is absolutely fantastic.
Yeah. And so, it was remarkable. So that really got me going too. Here it was, was able to use these skills right away. So, and plus it's fun and it's empowering. The patients I see, they're able, they've been to most of them been to so many doctors, and they've had so many tests done. They've tried different medicines that haven't worked. And so then they see me and they become better. Usually within 1 to 4 visits, my patients are better. I'm not saying 100% cured necessarily, although they may be, but there's significant improvement after only 1 to 4 visits. And so it's so empowering for them, and it gives them such increased self-esteem and self-confidence. It's just such a wonderful thing. Plus, rather than simply taking a pill, they learn a lifetime skill, because these are things that they're going to be able to use for the rest of their lives. Okay,
so you're sitting in a seminar and you're learning about the fact that hypnosis can cure the migraine headache. You call your daughter and she said, "Daddy, I've got one coming. You ask her if you'd like to try, and then what
No,
did you tell her to do?
try is not in my vocabulary. We
Okay.
don't try. We don't try. We do. You know, like Yoda in Star Wars, do or do not. There is no try. So I said, would you like to do it? She said, sure. And she did it, and she was able to prevent it. And in the future, whenever she'd have the aura, she was able to use her skills to prevent it. Yeah, remarkable.
All right. So what area of medicine would you say this will not work for?
Well, I mean, if someone has cancer, I would certainly not stop their chemotherapy. If someone has an infection, I would certainly give them antibiotics. So there are certain certain physical things that that you need to take traditional medicine. Now, having said that, one of the patient problems I treat patients with was called irritable bowel syndrome and abdominal pain and functional dyspepsia, which is known as heartburn. There are other similar conditions. And irritable bowel syndrome, the symptoms are people can have either constipation and or diarrhea and or pain and or nausea and or bloating. It can be a number of different things. And there are two main types of conditions that we're taught about in medical school, although they really overlap. There's something called functional gastrointestinal disorder. Functional means that all the tests are pretty normal, but the symptoms are real. So when patients have nausea or vomiting or diarrhea, and they go to the doctor and it's determined that they have irritable bowel syndrome, there's no medication that helps. Now the symptoms are real. These patients are not staying up at night thinking, how can I get out of school tomorrow? Oh, I know, I'll pretend I have a tummy ache. I'll pretend I'm nauseous. No, the symptoms are very, very real. But all the test results are pretty normal. In contrast to organic disease, so there's something called inflammatory bowel disease. Perhaps you've heard of Crohn's disease or ulcerative colitis. Those are biopsy proven. You go in, you take a biopsy, you look under the microscope. These are organic diseases. Now, interestingly, so you need to take Western medicine to help those things. Interestingly, though, patients with inflammatory bowel disease benefit from hypnosis and from cognitive behavioral therapy when used as an adjunct. So when people learn hypnosis and CBT for those conditions, there are fewer visits to the emergency room, fewer visits to the doctor's office, and you do blood tests and you do biopsies, and the inflammation goes down. It's one thing to understand the functional disorders. I can understand all the symptoms. The symptoms are real, but all the test results are normal. I can almost understand how hypnosis can help with that. But now you're talking about an organic disease, organic, biopsy proven, and hypnosis and cognitive behavioral therapy can help those. The power of the mind helps in a biopsy proven organic disease. That just blows my mind. So when I look at patients, it's not just either this or that. It's not functional or organic, because as I said earlier, there's a strong mind-body connection. So if you're feeling ill physically, it's going to affect you emotionally, psychologically, cognitively, behaviorally, neurologically, everything, and vice versa. And if you're feeling unwell emotionally, it affects you physically, of course. The typical thing would be, for example, I'm thinking of an 11-year-old girl I saw who was referred to me for functional abdominal pain. She had tummy aches Monday through Friday morning. Saturday and Sunday, she's fine. Monday morning, the tummy aches start again. Well, you don't have to be a physician to figure out that there was something bothering her at school. Now, the tummy aches were real. They were absolutely real. But whether it was because she was anxious, or maybe there was someone bullying her, or she had a learning issue, something like that, she'd get a tummy ache, and she'd get anxiety or whatever, stress, whatever you want to call it, from school, and that in her manifested as a tummy ache. And so as one of my dear colleagues and friends, Marianne Alt-Richer, wonderful social worker and brilliant, said when she sees kids like that, she says, "You have a very smart tummy." Think about it, Mr. Laney. You have a very smart tummy. That means Monday morning when your tummy ache starts, it's a signal that there's something upsetting you, there's something bothering you. And now you can use your hypnosis skills to control that tummy ache. Because, pain is pain, suffering is optional. And everything can be done and should be done, has been done. There's no need to pay any attention to those sensations that you're experiencing. So this is part of the introductory hypnosis training that we receive. Does that make sense to you?
This is really fascinating. information, Dr. Lazarus. I'm just, I'm eating it up, if you don't mind.
It's my pleasure.
And you know, of course, my mind races along, and when you're talking about the organic problem, you know, like with a cancer or whatnot, I can almost see Dr. Lipton saying, well, now, if you would visualize the good enzymes and hormones in your body relieving those issues, I can see it working in almost any situation. I read one instance where a gentleman was in an accident, and 6 vertebrae either broken or crushed.
Oof.
And the only option for him was surgery, to have 2 steel rods, one on each side of his spine, inserted. And he decided no. He decided he was going to go home and visualize healing. 9.5 weeks later, he was back to work.
Unbelievable. Unbelievable. And yet I believe it, of course.
And I guess that's really the key, isn't it? Is what can we believe?
Yeah. And what can we change?
Because your daughter at 9 years old, of course she believed her daddy.
Yeah, I had a wonderful rapport. You know, for this to work, you need to have rapport with the patient. And to me, that's the number one thing. I can be the best hypnotherapist in the world, but if I haven't connected with the patient, it's not going to work. And by the time I see patients and families, think about it. They've been through so much. You know, they've tried so many things. Nothing's helped, and they feel. And as I tell my patients, you know, I imagine you feel frustrated and disappointed and sad and worried and maybe even a little discouraged or stuck. And how could they not be? And I feel so sad to hear these stories. On the other hand, I feel hopeful because these are parents, and I see children, adolescents, and adults as patients. But for parents, you know, these are parents who love their children so much that they've tried everything, and then they're seeking me out because they want some help for their child. So, you know, a parent who loves their child that much, you know, they want to help their child, and I'm honored to help any patient, but particularly, you know, I just feel so sad for what parents go. I'm blessed with 2 daughters, and I remember years ago, someone very wise once told me, his parents are as happy and as healthy as our least happy, healthy child. Isn't that the truth? So, you know, yeah, you do anything for your kid. But it also, I'm sorry, go ahead.
Well, I was just going to ask what you do about lifestyle changes. Do you work with your patients on lifestyle changes?
If that's part of the problem that they're seeing me for, yeah. Can you be more specific?
Well, of course, there's obesity is pretty much covered by eating too much. But the reason I eat too much is because I am stressed, or I'm insecure, or whatever it is that's causing me to overeat. So that's a lifestyle change that's going to have a physical impact on my life.
Exactly. So so hypnosis can be helpful for that also. And I'm also trained in something called cognitive behavioral therapy, CBT. So then, and what happens with CBT, if I were to answer it in 10 seconds, when you change the way you think, you change the way you feel. And then when you change the way you feel, you change your behavior. So someone has what we call a negative thought. I'm stressed. I know I'm going to eat to relieve the stress. And then, you know, what does that do? Does it relieve the stress? Maybe temporarily. But then when they eat, then they feel bad about eating. And, you know, you go down that rabbit hole. I feel bad. I feel guilty. Now I'm gaining weight. So rather than say, hey, I have to eat to make to feel better, now you learn to talk back to those negative thoughts. Yeah, I'm stressed. Yeah, I have a big day tomorrow, or I have a big day tomorrow. I'm seeing many patients. In your case, I'm doing 10 interviews tomorrow. I'm feeling stressed, or my boss is mad at me, and so, you know, I'm eating now because I'm stressed with that, or I'm having an argument with my spouse, or whatever it is, and then I feel, you know, there's so many different forms of stress, of course, and I eat to feel better. Instead of doing that, I say, wait a minute, how can I address this differently in a more positive way? Wait a minute, yeah, my boss is mad at me, but I know she still likes me and she knows I do good work. I'll talk with her tomorrow, we'll straighten it out. Or my spouse and I, we love each other. Yeah, every spouse, you know, has different, you know, we all have arguments when we're in a a relationship, and we can talk this out. And then when you start to talk back to those negative thoughts with positive thoughts, then you say, I really don't have to eat. You know, I can talk back to these negative thoughts with positive thoughts. Another thing, a typical example is, you know, a kid who's going to take a test, you know, and he goes goes into the test. I'm going to flunk this math test. Now, this is a kid who's probably good, maybe a good student, who's never flunked a test before. I'm going to flunk this math test, but this is how the thinking works. If I flunk this test, then I'll get a lower grade. And then if I get a lower grade, it'll affect my grade point average. And then I won't get into the college of my choice, etc. So what we want to do, wait a minute, you know, I've never flunked a test before. Teacher knows I'm motivated, I'm doing good work. If I don't do well, then I'll work it out and I'll know for the next time. In answer to your question though, as far as the eating, yeah, I know I can survive if I don't eat. You know, yes, it's a habit I've gotten into, but then the behavior is so the cognitive part is to recognize the thought, oh, I got to eat to feel comfortable. And then the behavior, then talk back, no, I really don't need to eat to comfort myself. I can do deep breathing. I can do my visualization exercise. I can do Tai Chi. I can do the self-hypnosis, visualization, guided imagery that Dr. Lazarus taught me to calm myself and get through this moment. And then I don't eat, and I'm fine. But again, these are skills that all these skills take practice. They have to be learned in practice, just like any other skill that needs to be learned in practice, whether it's kicking a soccer ball or playing the piano. The more you practice it, the better you get at it. The more you practice it, the easier it gets. The more you practice, the faster you get at it. Because these are skills that need to be learned in practice.
Okay.
I hope I helped answer that question.
Oh, absolutely. Dr. Lazarus, and one other question here before we go. I don't want to take up all of your time, but at the same time, this is important information for our viewers. Name a problem that is prevalent today. I'm worried about COVID. I'm in a job where I'm making a lot of contact with people. I'm afraid I'm going to get it.
Sure.
So what advice would you give me?
Well, I think that you have to think about the worrying and you want to dial it down. You know, the worrying shows some wonderful things about you. It shows that you care. It shows that you have high standards. It shows that you want to take care of yourself. You don't want to get sick yourself, and you don't want to bring it home to your loved ones. Am I right?
Yes.
So why would you want to get rid of that worrying? Well, because it gets in my way. I can't think. I can't focus. I get butterflies in my stomach. My heart races. It doesn't feel good. Unpleasant physical sensations. My heart races, get a tummy ache, etc. So which side weighs more? The reasons to keep the worrying or the reasons to get rid of it? And of course, you don't want to dial down to zero. You want to have just the right amount. So and this is an exercise that I do with patients, and it's on one of my home programs, which I'll mention later. But it's called the Magic Dial, developed by David Burns, the pioneer in cognitive behavioral therapy and author of the book Feeling Good, the New Mood Therapy for Patients with Depression. He just came out with his new book, Feeling Great, which is terrific. And so he calls it the Magic Dial, the Magic Worry Dial, if you will, Magic Anxiety Dial. So before, you know, when you're really anxious, I'm really anxious, and I'm worried about COVID. How anxious are you? 0 to 10. I'm at a 9. And if I could dial it down to 0, would you dial it down to 0? Sure. But then I just showed you the reasons you wouldn't want to dial it down to 0, because, you know, it shows I care, shows I have high standards, but it's getting in my way. So what's the number between 9 and 0 that's higher than 0 but lower than 9? Because 0 shows you don't care, you don't have high standards. 9 is getting in your way. So most people choose between 2 and 4, something like that. So instead of being worried and on edge and just riled up and, you know, tense at a 9 all day, you can dial it down to a 2 or 3 or 4, whatever your magic number is. That's a very quick but powerful tool. I hope I made it clear.
Yes. Yes.
Okay. And this one too, I've developed a couple home video programs. I've had the privilege of lecturing all over the world, as I mentioned, but not everybody has access to this. So I developed a home video program for patients with bedwetting. It's called Keeping the Bed Dry. Nice positive reframe, and it simulates what I do in the office. First visit, and then there's homework, and then a week later you're supposed to watch a second visit and homework, third visit homework, fourth visit homework, and then I was asked by the head of pediatric gastroenterology at Stanford to make a similar program for his patients with irritable bowel syndrome and abdominal pain, because traditional medicine just typically doesn't help with those patients. So I created a unique program because all these patients with abdominal pain also have anxiety. So my program, it's called Controlling Your Gut Feelings, and Controlling Your Gut Feelings. And it, as I said earlier, increased worrying leads to increased symptom leads to increased worrying. So someone with irritable bowel syndrome, for example, what if I'm worried, what if I have to go to the bathroom during the math test? And then you get more worried, and then it makes your diarrhea or nausea worse, and then you get more symptoms, more worry, more symptoms. It becomes a vicious circle. So my program is designed to help alleviate the anxiety and the symptom control. So I find hypnosis to work great for the symptom control, and hypnosis can help with anxiety, and also cognitive behavioral therapy can help with anxiety, and also includes motivational interviewing techniques, so that when patients have this, I say, which is bothering you more? Is it the work? I imagine, you're feeling frustrated, stuck, worried, and I feel sad here about it, but I'm going to outline approaches that have helped countless children, adolescents, and adults around the world. Which is bothering you more? Is it the worrying? Then watch the section on worry control, which is basically a hypnosis session. Then there's homework. Then a week later, watch worry control follow-up. And then a week later, symptom control. And then a week later, symptom control follow-up. If it's the other way around, if the symptoms are bothering you more, then you watch the symptom control sections, then the worry control sections. So that's how the program works.
Okay. So how do people get a hold of you, Dr. Lazarus?
So they can get a hold of me through, I have 3 websites. I have jefflazarusmd.com, J-E-F as in Frank, F as in Frank, L-A-Z as in zebra, A-R-U, S as in Sam, M-D, all one word, jefflazarusmd.com. And if they want to look at my programs, controllingyourgutfeelings.com and keepingthebeddry.com.
Well, thank you so much for being with us today, Dr. Lazarus. Is there any one piece of final advice you want to give to people who are really suffering with stress and all of the disease that comes with a life filled with stress?
Get help. Be open to it. Share with a loved one. Talk with a loved one. Talk with a trusted person. And if you need to seek professional help, seek professional help. There's no shame in this. To me, it's a sign of strength when if you have a stomach ache and you go to the pediatrician, or if your kid has a stomach ache and it's appendicitis, you're going to go to the pediatrician, whatever it is. If you have an injury, you're going to go to the doctor. Well, if you have an emotional injury, if you're anxious or worried or sad or depressed, seek professional help. Be strong enough to. I view that as a sign of strength to recognize when you need help, not a sign of weakness. I hope that helps.
And the website again is
jefflazarusmd.com, J-E-F as in Frank, F as in Frank, L-A-Z-A-R-U-S as in Sam, M-D, all one word, jefflazarusmd.com. And to contact me directly, you can call me through there or send me an email through the website. I see children, adolescents, and adults, and with COVID now, it's all remote, of course. And even though I'm in California, because of COVID, I'm able to practice in many states around the country. And the home video programs, by the way, they're inexpensively priced, money back guarantee. Keepingthebeddry.com for patients with bedwetting, and controllingyourgutfeelings.com for patients with irritable bowel syndrome and other abdominal and gastrointestinal issues.
Give me a 20-second instruction on how I can get my child to stop wetting the bed.
Cannot be done in 20 seconds, but but you asked a good question. The main thing is the child motivated? Often the parents are motivated, but it doesn't bother the child. So in general, children under 8 years old are not motivated to be dry because they don't care. They're not going to sleepovers, and they're fine wearing pull-ups or whatever. It's when they get older and they start to feel embarrassed, then they're motivated. Often the parents are motivated, but the children are not. And so the child has, if it's your child, you have to make sure your child's motivated, not just you, the parent. Yeah. So.
All right. Well, thank you again, Dr. Lazarus. You've been watching Real Hope with W.L. Laney and my guest, Dr. Jeffrey Lazarus. Again, Dr. Lazarus, thank you so much for being with us on the program today.
Honored to be here. It was a pleasure. Thank you so much for having me.